I'm having a problem on my end. PHL Gov TV. I'm not getting text messages. I don't know if you've messaged me about the streams. So if there's some other way, someone can let me know whether the streams are up, and we'll get started. Dina, are you seeing stream? All right.
Yeah, like Sarah said, they're both up.
Okay, it's coming through now. I had a gremlin. All right, you guys can go ahead and unmute. Thank you. Okay, good afternoon, and thank you for joining our briefing on the City of Philadelphia's response to COVID-19. This is, as usual, for press only. If you're not a member of the press, you can log out of the Zoom room and watch on one of our live streams, including the Department of Health's Twitter and Facebook accounts, as well as PHL Gov TV on Comcast channels 64 and 1164, or Verizon channels 40 and 41. We're now going to turn things over to Mayor Kenny. Mayor, you have the floor.
Thanks, Mike. Good afternoon, everybody. I want to start by highlighting that the deadline for businesses to apply to the Pennsylvania COVID-19 Hospitality Industry Recovery Program, or CHIRP, has been extended one extra week. The new deadline for businesses to submit their application is 11:59 p.m. on Monday, April 12th. So there are now about 2 weeks left to apply. CHIRP is a statewide program created by the Commonwealth of Pennsylvania to support eligible businesses in the hospitality industry, which have been severely impacted by COVID-19 pandemic. Through this program, PIDC and the Commerce Department will distribute $17 million in funding to provide grants of up to $50,000 per eligible business. Businesses are encouraged to apply, including restaurants, food trucks, catering companies, small hotels, and bed and breakfasts. Businesses can apply at pidcphila.com/chirp. That's pidcphila.com/chirp. By extending the application deadline for CHIRP, we hope that all eligible businesses in the hard-hit hospitality industry will apply for funding. Hospitality businesses play a critical role in Philadelphia's economy, and given the burdens faced throughout this pandemic, we want to make sure businesses are aware of and apply for this significant source of financial relief. Finally, I want to remind Philadelphia families that the regular schedule for many students' meal distributions has changed this week because of the school district spring break. School district student meal sites will be closed this Friday, April 2nd, and will reopen next Friday on April 9th. However, most of the weekly food box sites will remain open this week. To ensure that families still have access to food, our partner at Share Food program has arranged for an additional 24 food distributions this week. These distributions are listed on the city's website. I encourage families to call 311 or visit phila.gov/food to find additional food for your household, especially while our regular weekly sites are closed for spring break. And now Dr. Farley has his update.
Thank you very much, Mayor. Unfortunately, our COVID case rise is accelerating and our hospitalizations are rising. So we need to get as many people who are over the age of 65 as possible vaccinated now to prevent deaths. Here's background and numbers. Since this time yesterday, we've identified 713 new cases of the coronavirus infection in Philadelphia residents diagnosed either by the PCR test or the antigen test combined. Now, for the past week, from March 21st to the 27th, We average 488 cases per day so far. We know we expect more. And of those people tested, 6.8% tested positive. For comparison, the week before, we were 427 cases per day, and 6.3% of the tests were positive. Now, those numbers of cases per day is approximately doubled in the past month. The cases are rising not just here in Philadelphia, but they're rising all around us, all across the United States, as a matter of fact, and they're particularly high in New Jersey and in New York. So the epidemic appears to be returning to where it began a year ago. Now, in addition to that, there's a report that you may have seen yesterday from the University of Pennsylvania School of Medicine, where their laboratory that was testing the coronavirus virus isolates found that more than 30% of their isolates were variants of concern. Mostly this is the variant that first arose in the United Kingdom. This is a variant that is more easily spread, but it doesn't cause a more serious infection, and it is prevented by vaccination. Now, if it's unclear if this variant is a cause or an effect of these rising rates, but it is clear that this is a new wave of the epidemic across the United States, and that this virus has and will continue to surprise us. Now, how are our hospitals doing? We hit a low back on March 7th of 203 people with this infection in our hospitals citywide. But with the increasing case rates, that number has been rising since. And yesterday it was 429, so more than doubled in just a few weeks. Now, our hospitals are not under strain yet, but this is a sign that this rise in infections is hitting not just people who are young, but also vulnerable people. On deaths, we now have 8 new deaths identified, bringing us to a total of 3,359. Now, we're averaging 25 to 30 deaths per week from the coronavirus in late February and early March. We're going to watch this number very closely to see if it rises, or if the vaccination that we're doing can keep the deaths down even as the cases rise, which is, we hope, what would happen. Now, let me talk about vaccination. You may notice yesterday there was a new CDC study that was released showing that the Pfizer and the Moderna vaccines were highly effective in real-world conditions here in the United States. That's great news. Even more so, they showed that they were highly effective even after one dose, about 80% effective. So, excuse me, that's very, very good news, and really points to the importance of getting any vaccine, especially now. Speaking more about vaccines, our supply of vaccines has been increasing. Last week, the doses that were allocated for distribution this week include 26,910 doses, first doses of the Pfizer vaccine. That's an increase from the week before, and 15,600 first doses of the Moderna vaccine. That's no change from the week before. In addition, we heard late Tuesday of last week that there were 9,200 doses of Johnson & Johnson vaccine given to us. That's still a relatively small amount of Johnson & Johnson, and it's unclear if we'll get any more since we continue to get very little information about future dose allocations for any of these vaccines. So we will be having limitations on the Johnson & Johnson dose, but we will distribute what we have available to us. Administration of the vaccines is this. As of Monday evening, we had data showing vaccination of 509,000 people with their first doses and 241,000 people who were fully vaccinated. Now, so we know that 23% of Philadelphia residents have received at least one dose. We also know that that's an underestimate, because some people from Philadelphia are vaccinated outside of the city, and we don't have that data in our databases. As of today, we know of 52% of the people aged 65 to 74, and 72% of the people aged over 75 have received at least one dose. Now, those numbers are not enough to change the direction of this epidemic wave that we're going through right now, but they are enough to prevent some deaths from COVID. And I think we need to particularly boost the numbers of the people over the age of 65 to prevent more deaths. More on that in a minute. For the week that ended March 28th, we had 111,000 doses administered across all providers across the city. That's so far, and that's even that data isn't complete. That's our highest number so far. That number was 50,000 doses administered on a weekly basis in February, so it's more than doubled in just a short time. Our target is to increase that to at least 150,000 doses delivered by week by all providers combined by the end of April. So how is vaccine being made available? We're having more sites enrolled at all times. We now have 226 sites that are enrolled, vaccine provider sites, and that are receiving vaccine. That's up from 204 a week ago. It includes hospitals and clinics, and an increasing number of pharmacies, now including 42 independent pharmacies that are now enrolled. In addition to those other providers across the city, there are now 9 neighborhood-based clinics that are operated by the Department of Public Health and the Fire Department and the Office of Emergency Management. Now, for those clinics that we are operating, the appointments are mostly filled, but at some sites there are available appointments, and the open slots have been filled by people who've walked up to those sites. We'll talk a little bit about vaccine eligibility. We're still in phase 1B. That's people who are frontline essential workers, people over the age of 65, and people with high-risk medical conditions. We will move to phase 2 no later than May 1st, and we'll move to phase 1C in April between now and then. We don't have exact dates for that yet. We're watching closely the steps taken by the Commonwealth of Pennsylvania. And we hope to, based on what they're doing in our internal discussions, we hope to have more information for you later this week and when we'll move to phase 1C. Now let me talk a little bit more about the people over the age of 65. More than 80% of the deaths that have occurred in Philadelphia from COVID are occurring in people over the age of 65. And in view of the epidemic wave that's happening right now, we really need to get these people who are most likely to have a serious infection vaccinated now. So my message to Philadelphia residents today is if you're over 65, not vaccinated yet, sign up now and get vaccinated as soon as possible. Don't delay. While I'm having that message for Philadelphia residents, we're also talking to vaccine providers for them to set a priority over the next few weeks for those people over the age of 65, such as fast track access or easy access or walk-up access, and as for many as possible, walk-in access, even for people who are not previously a patient. There aren't too many people left who are over the age of 65 who need to be vaccinated. And for those people, we want to make it as easy as possible for them to be vaccinated to prevent them, if they get infected in this wave, from dying. Now, let me talk about our federally supported sites. The Center City Vaccination Center at the Convention Center is now in the period where we're giving second doses to people who've already received their first doses of Pfizer vaccine. We've done that now for 1 week. There are 2 more weeks to go. And for then the last 2 weeks of the originally scheduled federal support, we'll be offering Johnson & Johnson vaccine. If we do that for 6,000 people per day, that'll be another 84,000 people, additional people who will be fully vaccinated by the end of April. Then, as you heard in the announcement yesterday, there will be a federally supported what's called Type 2 site. That is a high-volume site that is not quite the volume of the site at the Convention Center. That will start either late next week or early the following week. It'll be at the Esperanza Academy Charter High School in Franklinville, in the Franklinville neighborhood. The address is 301 West Hunting Park Avenue, and the zip code is 19140. If you look at our map, you'll see that that's one of the least vaccinated zip codes in the city, which is a large reason why the site is there. It also is at the center of the area of the city where we have the most under-vaccinated zip codes. In addition, that site provides easy access to a large Hispanic population in the city. We know that Hispanics are the most under-vaccinated group in the entire city. Also, the site is on transit lines, and it provides ready access to Roosevelt Boulevard and I-95, and we're working on steps to make make it easier for transit access. The site will be staffed in large part by federal staff, including FEMA and the National Guard, and there'll be local staff from the Health Department and the Office of Emergency Management there as well. The site will vaccinate at least 1,000 people per day. We hope more if possible, and it'll be in operation as planned right now, 8 weeks. Now, the way that people can get an appointment there, get vaccinated there, is going to be a combination of appointments and walk-ins, and we'll provide more information later on how people can schedule an appointment or get access to that site specifically for vaccination. So in general, what should people do who want to be vaccinated now? Go to www.phila.gov/vaccine-interest. If you don't have any internet, call 311 and they'll put you on our database. That's the way to be directed for multiple vaccination opportunities, including opportunities at the Convention Center, at the new site that's going to be at Esperanza, as well as the neighborhood clinics, as many opportunities as we are in connection to. Right now, this immediate period, our priority will be on those people who are over the age of 65. If you're in the database and you're under the age of 65, you may have to wait a little bit because we do, just during this next period, want to protect as many people over 65 as possible to protect them from this epidemic wave. Let me talk about our restrictions now for a minute. As you know, I'm increasingly concerned about rising COVID rates and hospitalizations. Yesterday, the Centers for Disease Control director made a plea for people to wear masks and keep their distance. So I want to make that same plea here. Everybody needs to do what they can to prevent catching the infection and prevent spreading the infection from others. But we have liberalized many of our restrictions across the city. And I do have to say now, if, as before, if our case rates continue to rise and our hospitalizations continue to rise and our death rates continue to rise, we may have to reimpose restrictions to save lives and to protect our hospitals from being overwhelmed. So what should everyone do right now? Well, just remember that the epidemic is still here, it's still growing, and it's still deadly. Everyone should wear a mask, keep their distance, and avoid being around others. And as soon as it's your turn, get vaccinated. All of our information is on our website, www.phila.gov/COVID. Thanks.
Thank you, Dr. Farley. And now we will go to Armando for the Spanish language translations of the mayor's and Dr. Farley's remarks.
Palabras del alcalde Jim Kenney. Buenas tardes. Quiero comenzar destacando que la fecha límite para que las empresas se postulen al programa de recuperación de la industria hotelera COVID-19 de Pensilvania o CHIRP se ha extendido una semana más. La nueva fecha límite para que las empresas presenten su solicitud es hasta la medianoche del día lunes 2 de abril. Y ahora quedan unas 2 semanas más para presentar su solicitud. CHIRP es un nuevo programa estatal creado por la Mancomunidad de Pensilvania para apoyar a las empresas elegibles de la industria hotelera que se ha visto gravemente afectada por la pandemia del COVID-19. A través de este programa, la PIDC, la Corporación de Desarrollo Económico Público-Privado de Filadelfia y el Departamento del Comercio distribuirán 17 millones en fondos para otorgar subvenciones de hasta $50,000 para cada negocio elegible. Se anima a las empresas a postularse, incluyendo los restaurantes, los camiones de comida, las empresas de catering, pequeños hoteles y los bed and breakfasts. Las empresas pueden presentar su solicitud en pidcphila.com/chirp. Esto es pidcphila.com/chirp. Al extender el plazo de solicitud para CHIRP, esperamos que todas las empresas más afectadas elegibles de la industria hotelera soliciten su financiamiento. Las empresas hoteleras desempeñan un papel fundamental en la economía de Filadelfia y dadas las cargas que enfrentan a raíz de esta pandemia, queremos asegurarnos de que las empresas se enteren y puedan solicitar esta importante fuente de ayuda financiera. Finalmente, quiero recordarles a las familias de Filadelfia que el horario regular de muchas distribuciones de comidas para los estudiantes ha cambiado esta semana debido a las vacaciones de primavera del distrito escolar. Los sitios de comidas para estudiantes del distrito escolar estarán cerrados este viernes 2 de abril y reabrirán el próximo viernes 9 de abril. Sin embargo, la mayoría de los sitios de cajas de comida semanales permanecerán abiertos esta semana. Para garantizar que las familias sigan teniendo acceso a los alimentos, nuestro socio en Share Food Program ha organizado 24 distribuciones de alimentos adicionales esta semana. Estas distribuciones se enumeran en el sitio web de la ciudad. Animo a las familias a que llamen al 311 o que visiten phila.gov/food para encontrar alimentos adicionales para su hogar, especialmente mientras nuestros sitios semanales regulares están cerrados durante las vacaciones de primavera. Muchas gracias. Y estas son las palabras del comisionado de la salud, del Dr. Thomas Farley, para el día 30 de marzo del 2021. El recuento de casos está aumentando y ahora aumentan también las hospitalizaciones. Es necesario vacunar a la mayor cantidad posible de personas mayores de 65 años para evitar muertes que, de cierta manera, son previsibles. Y comenzamos con los números del día de hoy. Hoy tenemos 713 nuevos casos confirmados por prueba PCR reportados desde el día de ayer, con un total de 123.489 casos. La semana pasada, del 21 al 27 de marzo, el promedio hasta el momento es de 488 casos diarios detectados por las pruebas PCR y las pruebas de antígenos, con un 6,8% de pruebas positivas. Para la semana anterior, del 14 al 20 de marzo, el promedio fue de 427 casos por día, con un 6,3% de pruebas positivas. Este número de casos se duplicó con respecto al del mes anterior. El conteo de casos está aumentando en todo el país, particularmente en Nueva York y en Nueva Jersey. Y la epidemia parece estar retrocediendo al punto donde comenzó hace un año exactamente. Hay información sobre las variantes del virus. De acuerdo a un informe del laboratorio de Penn, más del 30% de los casos provienen de la nueva variante, en este caso la variante del Reino Unido. Esta variante se propaga más fácilmente, pero no provoca una infección más grave. Las personas pueden protegerse de la infección a través de la vacunación. No nos queda claro aún si esta es la causa del aumento de las tasas, pero sí nos queda claro que se trata de una nueva ola en la epidemia en los Estados Unidos. Este virus nos ha sorprendido ya y parece ser que seguirá haciéndolo. Con respecto a los pacientes hospitalizados, llegamos al punto más bajo de pacientes hospitalizados en Filadelfia el día 7 de marzo, con 203 pacientes, pero con el aumento de los casos están aumentando las hospitalizaciones. Para hoy, 30 de marzo, hay 429 pacientes con COVID-19 que están internados en hospitales de Filadelfia. Los hospitales aún no están a su máxima capacidad, pero esto es una señal de que el aumento de infecciones está afectando a las personas más vulnerables. En cuanto a los fallecimientos, para el día de hoy se identificaron 8 muertes por el COVID-19 con un total de 3.359 fallecidos. En las últimas semanas, este número había ido disminuyendo gradualmente de 25 a 30 muertes por semana a fines de febrero, a menos de 20 muertes por semana en marzo, hasta ahora, pero esperamos que haya más. Estaremos monitoreando esta información de cerca para determinar si las muertes aumentan o si la vacunación previene las muertes a medida que los casos de infección aumentan. Con respecto a la vacunación, hay un nuevo estudio de los Centros de Control de Enfermedades que muestra que las vacunas de Pfizer y Moderna son altamente efectivas en condiciones reales. Incluso después de solo una dosis, estas vacunas tienen un 80% de efectividad. Esto señala la importancia de recibir cualquier vacuna disponible, especialmente en estos momentos. El suministro que recibimos de las dosis va creciendo. Tenemos asignada para su entrega esta semana 26.910 primeras dosis de la vacuna de Pfizer. Este número aumentó. Y 15.600 primeras dosis de la vacuna de Moderna. Este número no tiene cambios. También 9.200 dosis de la vacuna de Johnson & Johnson. Y continuamos teniendo poca información sobre las asignaciones de dosis futuras que vayamos a recibir. Con respecto a la administración de las vacunas, hasta el lunes por la tarde, 509.000 personas han recibido por lo menos la primera dosis de la vacuna y 241.000 personas están completamente vacunadas. Confirmamos que al menos 23% de los residentes de Filadelfia están parcialmente vacunados. Probablemente este porcentaje sea aún mayor. Para el día 21 de marzo, sabemos que aproximadamente el 44% de los residentes mayores de 75 años y el 34% de los residentes entre los 65 y 74 años de edad habían recibido al menos una dosis. Estos datos, sin embargo, están incompletos, ya que hay algunos que fueron vacunados fuera de la ciudad. No es lo suficiente, sin embargo, para cambiar la dirección de la pandemia, pero lo suficiente para prevenir alguna de las muertes por COVID. Tenemos la necesidad de aumentar la vacunación en personas mayores de 65 años para evitar aún más muertes. La semana que acabó, el 28 de marzo, aproximadamente se administraron 111.000 dosis hasta ese momento. Esto refleja un aumento de más del doble de dosis administradas semanalmente si lo comparamos con las 50.000 dosis que se administraban semanalmente en febrero. Esperamos aumentar a 150.000 las dosis por semana a finales de abril. ¿Cómo está disponible la vacuna en la actualidad? Ahora tenemos 226 sitios inscritos que están recibiendo vacunas. Teníamos 204 hace una semana. Los hospitales, las clínicas comunitarias y las farmacias están funcionando como centros de vacunación. Ahora tenemos 42 farmacias independientes que están administrando vacunas. También tenemos 9 sitios de vacunas operados por el Departamento de Salud, el Departamento de Bomberos y la Oficina del Manejo de Emergencias. Las personas están asistiendo a sus citas en su mayoría, pero en ciertos centros las personas pueden obtener su vacuna sin haber hecho una cita. Con respecto a la elegibilidad, estamos aún en la fase 1B. Pasaremos a la fase 2A, más tardar el 1 de mayo. Estamos observando los pasos que está dando la Mancomunidad de Pensilvania. Esperamos proporcionar más información sobre el cronograma para la fase 1C en el transcurso de esta semana. Con respecto a la vacunación para personas mayores de 65 años de edad, debido a esta ola de la pandemia, es necesario vacunar a las personas con más probabilidades de tener una infección grave por ahora. Entonces, si usted tiene más de 65 años de edad, por favor, regístrese ahora y vacúnese lo antes posible. Por favor, no se demore. Les pedimos encarecidamente a los proveedores de vacunas que establezcan como prioridad darlas a los mayores de 65 años de edad. Estamos ofreciendo un acceso directo a las vacunas para estas personas. Queremos vacunas a tantas personas mayores de 65 años como sea posible sin cita previa. En cuanto a la vacunación, en el centro de vacunación de Center City, en el centro de convenciones de Filadelfia, ha culminado una semana de segundas dosis y seguimos con 2 semanas más. Luego nos quedan al menos otras 2 semanas más de apoyo federal. Estamos en estas 2 semanas restantes para administrar la vacuna de Johnson & Johnson, a razón de 6,000 vacunados por día, con un total de 84,000 personas adicionales completamente vacunadas para fines del mes de abril. Con respecto al centro de vacunación tipo 2 de FEMA, está pautado para comenzar la semana que viene. Estará ubicado en el Esperanza Academy Charter High School, en el área de Hunting Park. La dirección completa es el 301 oeste del Hunting Park Avenue. Este centro está ubicado en el código postal 19140, uno de los códigos postales con menos índices de vacunación en la ciudad, y a su vez en un centro de la mayoría de los códigos postales que tienen tasas insuficientes de vacunación. El centro le proporcionará un fácil acceso a la población hispana, un grupo que está subvacunado en toda Filadelfia. Hay un fácil acceso por transporte público y asimismo también un fácil acceso por el Roosevelt Boulevard y la I-95. Este centro estará operado por personal federal, personal de FEMA y por la Guardia Nacional. Este será solamente personal médico, netamente. Nuestra meta es de vacunar al menos 1,000 personas por día, más si es posible, durante 8 semanas. La modalidad será combinada, con cita y sin cita. Más información se dará sobre esto más adelante. ¿Qué deben hacer las personas que quieran vacunarse? Primero, registrar su interés en fila.gov/vaccine interest. Si usted no tiene internet, llame al 311 y le ayudarán con el registro, y también puede hacerlo en español. En este momento, la prioridad será de invitar y vacunar a los mayores de 65 años de edad. Si usted es menor, usted puede que tenga que esperar un poco. Con respecto a las restricciones del programa Más Seguro en Casa, estamos cada vez más preocupados por el aumento de las tasas del COVID y el aumento de las hospitalizaciones. El director de los Centros de Control de Enfermedades nos pidió ayer usar mascarillas y mantener el distanciamiento social. Como lo dijimos antes, si aumentan las tasas de casos, las hospitalizaciones y las muertes, entonces es probable que tengamos que volver a imponer restricciones. Un recordatorio, la epidemia sigue aquí, sigue creciendo y sigue siendo mortal. Así que por favor, utilice su mascarilla, mantenga la distancia social, evite estar cerca de otras personas y tan pronto como sea su turno, vacúnese, porque solo juntos podremos dar lucha a esta pandemia. Muchas gracias.
Thank you, Armando. And we're going to move now to Q&A from members of the press. I first wanted to clarify the location of that type 2 site at Esperanza. Our press release yesterday, as well as our comments this morning this afternoon referred to the Academy Charter High School. Actually, the vaccine clinic's entrance, when it opens next month, will be at 5th Street and Hunting Park Avenue. Again, will be at 5th Street and Hunting Park Avenue. Today, we are joined by Managing Director Tumar Alexander, and for questions on FEMA's role in both the Type 1 vaccination site at the Convention Center, as well as plans for that Type 2 site in North Philadelphia, we are joined today by Charles Ellison, who is Community Preparedness Officer for Region 3 for FEMA. Because of limited time, only one representative from each media outlet is permitted to ask questions for the first round. If we have time for a second round, we can open it up to others and to topics not related to the COVID-19 pandemic. And let's get started now. First off today is Martin Pratt of Philly YBN. Martin, you're up.
Thank you. Question for the mayor or Tumar regarding rent moratorium, knowing that COVID related rent assistance hasn't reached tenants yet. So will there be an announcement tomorrow?
Tumar, are we concluded that yet or not?
Sorry, Mayor. I don't think we have. We're still working on it. Martin, let me get back to you before the end of this presser with the answer to that.
Thank you. Second question is for Dr. Farley. have the numbers, you mentioned the need to make sure people in their 60s get vaccinated. Have the numbers increased in the African-American community?
They have increased in the African-American community. They have not increased enough. We still have a big racial gap. And so we are doing everything we can to increase access in the African-American community and also to promote vaccination in the African-American community with, among other things, the media campaign that we announced last week.
That started already?
Yes.
Okay, thank you.
All right, thank you, Martin. Let's go to Johann Calhoun of Chalkbeat.
Thank you. These questions are for Dr. Farley. Since COVID cases are rising, do you suggest Philadelphia schools sticking with the 6 feet distance as compared to the relaxed 3 feet distance the CDC announced last week?
We are following the CDC guidance on schools, which it permits, my understanding is permits 3 feet distance in elementary schools if a variety of other safety precautions are underway, but it does not permit that in the middle school or the high school level if the community case rates are high, which they are in Philadelphia.
Okay, where are we in helping the district with the COVID dashboard?
The district is going to take responsibility for posting a dashboard on their testing in the schools.
So you're going to supply the district with the numbers? How is that system going to work?
Now, the numbers come from the district. They're the ones that have access to the testing and knowledge of students who are ill. We don't have knowledge of what students or teachers are ill. We know about cases, but we don't know if they were a student or a teacher. So they have that information and they'll just post it themselves.
Okay, and can you give us an update on teacher vaccinations?
I can only say that the CHOP has vaccinated more than 19,000 teachers, and the teachers, I should say teachers, school support staff, and child care workers. And for those staff that were not able to be vaccinated by CHOP and who are still interested, we are giving them a variety of other options for being vaccinated. A number of them went to the convention center, others are being vaccinated at other sites. I don't have a total number of people vaccinated, but overall it's making a lot of progress.
So Dr. Hite plans on reopening all the schools in the fall. Do you see all the teachers being vaccinated before July, August?
Certainly all the teachers will have an opportunity to be vaccinated before then. It's a question of how many of them will choose to be vaccinated. And we hope that percentage and that number is very high.
Okay, thank you.
Thank you, Johann. Let's go to Laura McChrystal of the Inquirer.
Hi. Dr. Farley, a question on the hospitalizations. You mentioned they were increasing. Is the age of those hospitalized patients, has that been decreasing? Like, are they younger, or is that looking different given the vaccines going out?
I have two numbers we're looking at on hospitalizations. One is how many people are in hospital beds at any given day, and those are the numbers that I've been reporting here in the press conferences. We have a separate number of how many people are being newly hospitalized per week. And for the first number, I don't have a breakdown by age. The second number, I do have a breakdown by age, but it tends to lag behind. It's only maybe from 2 weeks ago. So I think it's really too early to say whether we have a change in the age distribution of those.
Okay, thanks. And a question on, at the FEMA site at the convention center, and also at the city clinics that had just opened in the past few weeks, as the FEMA site and also other clinics have to start giving second doses to people who got first doses. Are we going to see a drop off in the number of people actually getting vaccinated? Or are you making up for that with other providers?
I'm not sure. You're saying because we're giving second doses at the convention center site, we'll be reducing the number of people who are newly getting their first doses. Is that the question?
Yes.
There will probably be a plateauing or maybe a slight decrease, but we do have increases in vaccinations that are occurring across all the range of providers in the city. The convention center site is a very important site for us, but it's not a majority of the vaccinations delivered in the city.
And lastly, will the convention center site be still closing after it reaches 8 weeks, or will it stay for longer?
We have requested from the federal government to have it stay longer, and we don't have an answer yet as to whether that's possible.
Thanks.
Thank you, Laura. Let's go to Isabel Sanchez of Telemundo.
Hi, how are you guys? My question is for Dr. Farley, and Armando, I would love a translation for this question once he responds. Dr. Farley, is there any more information on demographics regarding who is getting sick now? Any information on this? New cases are coming up. Are we talking younger people, older people? Any demographics with that number?
It is occurring. Oh, I'm sorry. Translate the question first.
No, go ahead, Dr. Farley.
The increase is occurring across the entire age range, which that's what concerns us, is that there are still older people who are getting infected. And it is occurring in all demographic, all racial groups. The racial group that has the highest rates in the past few weeks has been whites.
La pregunta que nos hace Isabel para la comunidad hispana es si hay alguna información con respecto a los datos demográficos de quién se está enfermando, si son la gente más joven o la gente mayor. El doctor Farley nos responde de que ha habido un aumento a lo largo del rango de todas las edades y toda la demografía, incluyendo la gente mayor que se está infectando, y a través de los grupos raciales vemos que los mayores incrementos se han dado entre los pobladores de la raza blanca.
And my second question, Dr. Farley, is also for you. Do you hope that this new FEMA site could help bridge that gap that we're seeing with Latinos getting vaccinated? And as part of the effort to reach this community, is the city considering maybe doing like door-to-door outreach or any other kind of effort to make sure that folks who live in the neighborhood actually get vaccinated?
Yes, we're very hopeful that this site can help close the gap between Hispanics and non-Hispanics. It's really at the heart of the Hispanic populations in the city. And we will be working with community organizations and otherwise doing outreach. I'm not sure we're going to be able to go door to door, but we will be doing outreach in neighborhoods to encourage people to use the sites.
La pregunta de Isabel es si se espera de que este nuevo lugar de FEMA pueda ayudar a salvar la brecha que impide que los latinos se vacunen a unas tasas aceptables en la ciudad, y si se está considerando hacer programas de apoyo y de cercanía a las comunidades para lograr la vacunación. Y el doctor Farley nos responde de que tiene la esperanza de que este esfuerzo de FEMA pueda ayudar a cerrar esa brecha y que se pueda lograr índices de vacunación similares para los hispanos como para los no hispanos, y que sí se va a contactar a comunidades a través de las organizaciones comunitarias, pero que no se contempla en este momento hacer un esfuerzo de ir puerta a puerta, pero sí publicitar los esfuerzos para que la gente acceda a las vacunas.
And I'm so sorry. One more. Dr. Farley, other states like Delaware are now opening vaccination for younger people. Is this, I know that's going to happen eventually in April, but is this something that, since it's happening around us, is something that you're considering doing in Philadelphia in the next few weeks?
We said that we'll open it up to all adults no later than May 1st. It's possible we'll go earlier than that. Right now, I'm very concerned about this particular epidemic wave. And so I want to make sure that the people over the age of 65 who are the most likely to die, 81% of our deaths are in people over the age of 65. I want to make sure that they're vaccinated. So I don't want to introduce an eligibility of a very large number of 20-year-olds or 30-year-olds who are at low risk right now for fear that they may take up the slots for the people who are over 65. It'll be soon, but it's not right yet.
Thank you.
La pregunta que nos hace Isabel es si, siguiendo el ejemplo del estado de Delaware, que ha empezado a vacunar a poblaciones más jóvenes, y se está contemplando también hacer lo mismo en Filadelfia, y tratar de vacunar a poblaciones más jóvenes. Y la respuesta del Dr. Farley es que estamos abiertos a que se vacune a todos los adultos, y probablemente eso se empiece antes del 1 de mayo o incluso antes. Sin embargo, dada esta última ola de la pandemia que tenemos, no queremos exponer a las personas mayores de 65 años de edad a que no puedan acceder a las vacunas porque gente en sus 20s y sus 30s están vacunándose. Entonces vamos a mantener la elegibilidad por ahora para tratar de proteger a los ciudadanos mayores de 65 años. Pero eventualmente sí, se va a vacunar a todos. La gente joven puede resistir la infección a los 20 y 30 años, pero los mayores de 65 no. Por lo tanto, ellos van a tener la prioridad por ahora. Gracias.
All right, thank you, Isabella. Thank you, Armando. Let us now go to Jack Tomzik of Metro.
Thank you. This is for Dr. Farley. Is there any indication of why these cases are accelerating? I mean, I think people are wondering, is it the variants? Is it people relaxing their behavior due to COVID fatigue?
Yeah, it's some combination of those two, and which is contributing more is not clear. I don't know that we'll ever be able to know. The solution is still the same. We want to, have people be careful with their behavior, wear a mask, keep a distance, and vaccinate people as quickly as possible.
And this is either for FEMA or for Dr. Farley. What vaccine will be administered at the Esperanza site?
We're still working that out. We have to. This is a site that we need to probably provide vaccine ourselves, but so we don't have an answer on that yet.
Okay, so this is not going to be a separate federal allocation.
Typically, these type 2 sites don't come with a separate federal allocation.
Then one final question about prioritizing the people ages 65 and older. How is that information being disseminated to the providers? Are you telling them restrict these doses and just go for 65 and older, or how does that work?
No, we're communicating to providers to say that these other people who are currently eligible are still eligible. We want them just for the next few weeks to try to figure out how to set a priority for people over the age of 65, such as having a fast track of some sort, of allowing walk-ins or doing additional outreach. Each one is going to do it somewhat differently, but and that'll be just through our direct communications to providers.
All right, thank you.
Thank you, Jack. Let's go to Kennedy Rose of the Philadelphia Business Journal.
Hi, I have 2 quick questions for Dr. Farley. I was wondering, regarding restrictions, what would be the first thing to go? Would the city be working in reverse order, like shutting down indoor dining, reducing event capacity, getting rid of attendance at sports? What would be the first thing to go?
It's too early to talk about what exactly we would be doing. So I'm not going to speculate now.
Okay. And I was wondering, from your contact tracing efforts, where are the cases mostly coming from? Are you seeing increases from people who are indoor dining, indoor gatherings? Where's that coming from?
Well, so unfortunately, we've had to redeploy almost all of our contact tracing team to assist with the vaccination effort. And so we're not getting the same level of information we had in the past. So we can't say for sure.
Okay. Thanks very much.
Thank you, Kennedy. Let's go to Lauren Make of NBC 10.
Good afternoon. Dr. Farley, you had mentioned that we would move to 1C sometime in April and then phase 2 by May 1st. President Biden has now said that 90% of adults will be eligible by within 3 weeks, which is a little bit quicker than that May 1st deadline. Will that be the case in Philadelphia?
No, I can't announce a schedule today. As I said, I am reluctant to move too quickly to make all adults eligible for fear that they may push out of the way the people who are the most vulnerable, who are people over the age of 65. So when we feel comfortable that there's been adequate opportunity, we've had an adequate percentage of people who are the most vulnerable vaccinated, then we'll move to the younger folks. But I can't announce a date on that yet.
Is there a certain number that you're looking for in terms of level of vaccinations for those 65 and older, or the number of new hospitalizations coming down or something like that you're looking for to know, yeah, we've got enough, we can move on?
Well, I had predicted earlier that if we went on a current trajectory, we would have 75% of people over the age of 65 vaccinated by the end of April. I would like to, with what we're doing now, to have that be sooner. Certainly would like to have at least 75% of people on the most vulnerable group vaccinated.
Because of what you're seeing?
Yes, because I did not predict this particular epidemic wave. And so I think that there's really some urgency around this most vulnerable group right now. And then if we can get them protected, then we have a little more time to vaccinate everyone else. The vaccinating everyone else, the benefit of that is to reduce the number of cases. But vaccinating the elderly people, the benefit of that is to prevent them from dying of the infection.
Given your concerns about hospitals becoming overwhelmed, what preparations is the city making, or the city asking hospitals, working with hospitals to make for a possible surge?
So we're in very close contact with the hospitals and have been for the last year. And every one of them has a variety of plans that they can put in place pretty short on notice to make additional bed space available. They can, for example, cancel elective surgery. They can open up additional wings. Often they have where they could put in additional beds. So we do think that they have those options, and those are, they need to be prepared for those options. So it's mainly just keeping in contact with them about this potential.
Okay, last thing quickly regarding the arts community. And I know some of the theaters, the Kimmel Center, for example, making plans to open possibly with full capacity. What are your conversations with the arts venues in the city, and how will it be determined whether they're allowed to open with?
Well, currently these events and gatherings are permitted at a certain percent capacity, and which is a lot less than full capacity. I think they're talking about in the fall, and the fall is a long way off. We hope that by the fall, a very large percentage of the city will be vaccinated, and we hope that the epidemic will be at low levels, if not gone entirely. But that's a long way off. As you've seen, this virus continues to surprise us. So we really can't make any kind of commitments now as to where we're going to be in the fall.
Thank you.
All right, thank you, Lauren. And a reminder that reporters are asked to limit their questions to 3 or fewer so we can make sure we get to everybody. Next up is David Murrell of Philadelphia Magazine.
Hi, Dr. Farley. First question is for you. You said earlier that you do have hospital data, age data, I think, for new weekly admissions. Can you just give a rough sense of, prior to the latest wave, what the, I guess the median or mean age was for most hospital patients?
We can get you the distribution. I don't have it on top of my head, but right after the press conference, we can get you some of those numbers. Yes.
Okay. The other question I had, I've heard that the Black Doctors Consortium has received $9 million from the city for the vaccination RFP. Can you confirm that that's the case?
No, I can't. What we announced last week, what the groups that were going to be funded, but we're in budget negotiations with all of them, so I can't confirm any particular budget.
Okay, so do you have a sense of when that process is finished, or if it's still underway?
I can't give you a specific date on that now, really, because it's back and forth between the city and those organizations.
Got it. And last thing, do you have an anticipated date for when that process will be concluded? And also, is the city planning to release the full contracts with each of the providers for transparency?
So the process is open-ended, right? New organizations can apply now. So as long as we feel that there's a need for more providers, there's an opportunity for more organizations to apply and get funding. And I don't know about releasing the contracts. We'll have to see about that.
Okay, thank you.
Thank you, David. Let's go to Manny Smith of CBS 3.
On mute there. First question is for Dr. Farley. We've been seeing reports of some people who got previous coronavirus testing getting bills from, because they got them with the Philly Fighting COVID group. Have you guys heard of complaints in that area? Have you been helping them, or have they been reaching out to the health department for help in that area?
I have not heard of that being a problem. There may have occurred in some instances, and we will we'll assist if we do get some of those, but I have not heard of that.
Also heard that there might be a plan for the city to clear the subway encampments over on Locust Street in Center City tomorrow morning. And we did some previous reporting on something planned soon for Reading Terminal Market. I know advocates have been concerned about moving those folks in the middle of a pandemic. Are you aware of those?
Manny, if you shoot the press account an email, and we'll get you a response on that.
Okay, no problem. And now that we're near the end, I did have one question for the mayor. That's second round question. Can I go ahead and ask it now?
No, I'd like you to hold off if we have time. Let's get to COVID questions only. Do you have anything further?
No, that works.
All right, hold on. Let's go now to Pat Loeb of KYW.
Tumar, has the city approved any special event permits?
Not to my knowledge, I don't think we have, although I do know, I believe we have a couple that's in the review process now.
Okay, any timeline on when there may be an answer for them?
No, I don't have a specific timeline.
Okay, thank you. That's it.
Welcome.
Okay, Pat. Let's go to Denise Clay Murray of the Philadelphia Sun.
Yes, good morning, everyone. I think this question goes to both the mayor and Dr. Farley, depending on who can answer it best. At the beginning of the epidemic, there was a pretty big issue with personal protective equipment. What is the status of that for the city now, especially with schools reopening and with a resurgence of the virus and hospitalizations?
Doc, do you know?
My understanding certainly is that the healthcare institutions are able to get adequate PPE, that there's not a shortage right now. And certainly, citizens can buy masks everywhere. So I think we're in a much better place now than we were a year ago.
Okay, thank you.
That was it, Denise. You're good?
Yes, I am. Thanks.
Okay, very good. All right. Well, then we do have some time for a second round. Manny, if you're there, go for it.
I am still here. This question is for the mayor. In light of the Derek Chauvin trial, which is underway in Minneapolis, we hear that city officials have been collaborating on a security plan. Should there be a verdict that most people don't expect? Can you comment if that's underway and what that might include?
Yeah, there's been conversations. I won't get into specifics because we're not there yet. I've been watching the case myself when I can in my office. It seems overwhelming that the prosecution is putting on a pretty convincing case. However, as we saw with Rodney King and some other stuff back in the day, it doesn't always turn out the way we expect it to turn out or the way it should. But we are having conversation with police department, governor's office, with managing director's office, and we're putting together a plan to respond in the event that something goes wrong.
I know that you guys have been deep into the response of the last set of civil unrest that kind of led to some tear gassing and concerns. So if city residents say, "Hey, we hear you guys are talking," and now we are more concerned that something could happen to us, is there something you want to say to them?
Well, what I would hope is that justice is done and the right verdict comes out. I would also remind folks that what we've been through already in the last year with the law two times, with the civil unrest, which resulted in some cases in violence and looting and vandalism, that we realize where we are now, that we're getting back out of this mired mess, and we don't want to go back there again. And regardless of what happens, we're all Philadelphians. We all need each other, and we all need our businesses to be intact and our neighbors to be intact. So all working together in good faith with each other, we won't hopefully have a repeat of what we've seen in the past summer.
And finally, Mayor Kenny, some really significant incidences of violence, even at the Philadelphia Mills Mall. We hear it might have affected even a city employee. Any comment or reaction on that, please?
Obviously the violence is very upsetting and very heart-wrenching, and it's affecting, neighborhoods throughout the city and many, many families. Police are doing everything. As you've seen today, the number of VUFA arrests that we've had in the last year are increased substantially, and we're taking guns off the street. Our police officers are wading into harm's way to do that, and we thank them for it. But there's too many guns in our society and too many guns in Pennsylvania and in Philadelphia, and we're going to struggle with and continue to struggle with this problem. As long as you can get a gun in Pennsylvania faster, you can get a driver's license.
All right, thank you very much.
Thank you, Manny. Let's go to Denise. Go back to Denise Clay. Denise.
Thank you. I'm back. There was an article in the Inquirer this morning regarding the number of gun violence cases and how they're not necessarily leading to convictions in the city. I wanted to ask the mayor, why do you think this is? Do you think it's a training problem in terms of gathering evidence? Do you think that there's some sort of a disconnect that's going on? And if so, what do we do about it? And for you, Dr. Farley, there's been a lot of talk about people viewing violence as a health issue. Have you thought about what your plan for that would be if that's the way we decide to go?
Well, first of all, obviously the police are doing their job in getting guns out of people's hands. The criminal justice system has been a bit, I guess, out of kilter, out of sync because of COVID and the lack of the number of trials and the activity of the police, activity of the courts. Probation and parole has been also hampered by this. So hopefully, as we get more vaccinations, more people back to work, we can get our criminal justice system working again the way it was. But there's a significant issue relative to convictions and gradations of charges, and people who continue to carry guns even after been arrested once, twice, three times needs to be, as our police commissioner says, needs to be a penalty for that. Needs to be some you'd be called to account for carrying guns on a regular basis. And if we get that done, if we can get that done, maybe the word will go out that you shouldn't carry a gun on your person or in your car unless you have permission to do that. We're continuing working hard every day to address this problem. It's multifaceted, but I do believe the criminal justice system needs to work better in order to keep people safe.
Thank you, Denise. Let's go now to Johann Calhoun. We have 3 minutes left and 3 questioners. So Johann, Kennedy, and Martin, and then we'll wrap. If you could limit it to 1 question each, I would appreciate it. Johann, you're up. Johann, you'll have to unmute. There you go.
Okay, can you? Okay.
Yep, go ahead.
Okay, going back to the schools, the district recently announced more students are going back to school next Tuesday. And of course, these numbers are up. What precautions should students, teachers, staff take to help contain these numbers? And I'm going to just give you like a quick scope of things. Parents United for Public Education, the Caucus of Working Educators, created a COVID.
Johann, I accidentally muted you. I apologize if you can unmute yourself, but we are very tight on time. So if we could if you could wrap up your question there.
Okay, can you hear me now?
Yeah, go ahead.
Okay, yeah. So this is going back to the COVID dashboard that the Parents United for Public Education and the Caucus of Working Educators reported. Last week, 19 COVID cases were found between March 22nd and the 26th. And with these numbers rising, what precautions should students, teachers, and staff take to help contain these numbers now that the district looks like it's moving forward and bringing more kids back to school?
Well, first, the large number of students involved and the high rates we have in the city, it's not a surprise that there would be some cases occurring in students. As far as what to do, there's a whole set of safety standards that the Centers for Disease Control has written, and we have a whole set of guidance as well for schools. It centers around mask and distancing, and then a lot of detail on how to do that in a school setting. And there's also procedures in place for what do you do if you have somebody who tests positive, as far as quarantine and isolation to prevent further spread. And so they just need to follow those as closely as possible.
All right. Thank you, Johann. Let's go to Kennedy Rose of the Philadelphia Business Journal.
Hi, thanks for taking the time. I just have a super quick follow-up for Dr. Farley. Going back to what you said earlier, Dr. Farley, about contact tracing, if so much of the contact tracing team has been diverted to vaccination efforts, what are you factoring in when it comes to which restrictions to impose or continue to impose? Like, what factors are you counting in?
Well, we've always based our restrictions on large part on the evidence that's available elsewhere, or in general, about what are high-risk settings, and then our understanding about what sort of behavior is taking place in these settings. There's very strong evidence, as you know, that restaurants and bars are very high-risk settings, for example, which is why a lot of our restrictions focus on restaurants and bars. And that comes from a variety of different studies of different types across the country. Any other large gathering where people are together indoors, not wearing masks, is likewise going to be a very high-risk setting. And so the contact tracing is designed to prevent spread when you have a first case. The contact tracing is not a study to determine how a person got infected. So the contact tracing information was always useful to us, but it was an adjunct to the rest of that information.
All right, thank you, Kennedy. And finally today, the guy who started us off, Martin Pratt of Philly YBN.
Thank you. This is for Dr. Farley. I saw that the colleges, several are setting up their commencement, and one is in May 13th, I believe. Has your office been consulted at all about the setup of these commencements they are outdoors, but from the tweets I'm seeing, there's going to be a crowd?
We are in contact with the colleges. We have city employees and health department staff meet with them on an almost weekly basis. I don't know if they've looked at their specific commencement plans, but we do have guidance about outdoor gatherings in general. And so I would imagine and certainly hope that any of their graduation ceremonies are following that guidance.
Okay, thank you.
Thank you, Martin, and thank you, everyone. This reminder that because this Friday, April 2nd, is Good Friday and a city holiday, Dr. Farley will not be holding his regular weekly press conference on Friday. So we will resume with a press conference next Tuesday instead. Thank you.